So good morning, everybody. Welcome. Thank you for taking the time out of your busy schedules to be here today. I suppose I should also say good evening, good afternoon, depending on where you're calling in from. We're very excited to share what is actually our final presentation in the 21-22 grant webinar series for this summer. If you haven't had the opportunity to jump on to any of the other sessions, you can find those recordings on the events page of our website. Today's session should be available tomorrow, Monday, the latest. Please also keep in mind that we will have one additional webinar coming up in September that will be presented by our New Zealand and Australian collaboration group. And that sign up is currently available on our website as well. As a reminder, today's session is going to be recorded for future listening, and we do encourage you to share this recording as well as any of the others with your students, colleagues, peers, whoever might be interested in learning more about the efforts that were put forth by our collaboration groups. These are especially helpful if you are interested in applying for a grant this coming year. So in light of that, my screen is, of course, not working. I would like to introduce Corey Kilgore, who is the Executive Director of the MHCH Foundation. It's due to the generosity of the MHCH Foundation that GRNEN was able to launch the Global Rural Nursing Virtual Collaboration Grant. Thanks to their continued interest in supporting our mission, they are going to be awarding 3 new grants for the 2022-2023 timeframe. Applications are currently being accepted for this program, and anyone is interested in applying, learning how your university can apply, is encouraged to visit grnen.org. All of the eligibility and guidelines are posted, as well as the application. Submissions are required by August 1st of this year. And now I'd like to turn it over to Corey for a little bit about the grant.
All right, thank you, Stacy. Hello, Kenya, and hello, North Carolina, and hello to all of our guests. I want to thank each of you for coming back to share your work. I know that sometimes that's difficult after the semester is over. In the U.S., we're in our summer time frame, and so we really appreciate you coming back and investing the time to share your learnings. You are one of 5 recipients of the grant for the 2021 academic school year. This is the first time that the MHCH Foundation has done this. So historically, we are not a grant-making foundation. So we are also learning how to make this the most effective and the most quality opportunity for the grantees. So we appreciate also your willingness along the way to kind of share with us how your project was going and how it could be improved for the future. Because you were the first group, I do know that we kind of had some things in the beginning that were a little rough. We were still working on trying to roll out the new community platform, the new tool, and it had not quite gone live when you initiated your project. So that's one of the things that we're hoping in the future we'll be able to change for our future grantees. So we appreciate you for 2 reasons. One is for all of your hard work, and the second is for allowing all of the future grantees to learn from your experience, whether it was positive or negative. It all is helpful, right? Thank you very much for all of that, all of your help. And the application, like Stacy said, is now open, and our grantees for next academic year will actually have 6 additional months to finish their projects. This first group of grantees had a 12-month period of time. Actually, it was less than 12 months. In the future, we'll be adding an additional 6 months, because one of the things that we've learned is that when you're partnering internationally, you tend to have different schedules as far as how your academic calendars look. and sometimes that can make it difficult. So in the future, we'll have more time. And so we encourage everyone to apply, and actually it is perfectly okay to apply a second time. So thank you. And we're looking forward to hearing you share your work.
Thank you, Corey. Before we get started, just a note on some housekeeping. We will have plenty of time for Q&A at the end of the session. So if you have any questions during the course of the presentation, feel free to drop that either in the Q&A feature on your Zoom panel or in the chat. We will be holding them to the end, where we will ask them to our wonderful presenters on your behalf. And now I would like to introduce today's presenters. Colleen McGovern completed her PhD in nursing at The Ohio State University in 2018 and a Master's of Public Health in 2015. She also holds a bachelor's degree in nursing and in elementary education. Prior to pursuing a PhD, Colleen worked in critical care and community settings with a special interest in health disparities and the needs of underserved populations. She completed the Nurse Educator Certificate and has experience teaching implicit bias and pharmacy classes to undergraduate students. Colleen's research focuses on the intersection of chronic physical conditions and mental health in children. Specifically, she is interested in the development and implementation of theory-based interventions for children with asthma and anxiety depressive symptoms to improve physical and mental health outcomes. David Oluoch has a Bachelor of Science in Nursing and has been practicing as a community health nurse for over 22 years. In addition to being a community health nurse specialist, David is currently pursuing a master's in midwifery and reproductive health at the Masinde Muliro University in Science and Technology in Kenya. David works with the government of Kenya and has coordinated home and community-based care, reproductive health, and community health services in Rarieda subcounty in Kenya, in Kenya. David is a part-time lecturer at Matibabu and the Mondo Medical Training College in Kenya. And now I would like to turn it over to our presenters.
Corey, thank you so much. Thank you, Stacy, for the introduction. And Corey, thank you so much to you and the foundation for this really beautiful opportunity this was my first foray into international collaboration. So I really appreciate that very much. David, I don't know if you wanted to say anything while I'm sharing our screen here for the PowerPoint. Okay, please confirm that you can see the screen that I'm sharing here. Okay, thank you. So our program, our grant, our project was, the acronym is INTOUCH, International Nursing Technological Outreach Uniting for Community Health, a collaboration between Kenya and the University of North Carolina at Greensboro. And so the background of Matibabu, David, I would ask you to go through this, please, for your institution.
Okay, thank you, Colleen, for support and putting up the presentation. Before I start, I want to thank you. I was glad to be part of this. I have learned a lot. It was a new project, but I want to thank the team that they could allow me to be a party to this. I want to thank Colleen. It was a good collaboration. I was learning, and surely she's a good mentor. So Matibabu Foundation College of Health Services was established in 2014 to offer diploma in Kenya registered community health nursing. The college has since expanded to offer other courses like certificate in computer packages, perioperative, theater technology, level 5 and 6, and other related courses. It is accredited by the Nursing Council of Kenya and Technical and Vocational Education and Training. Next. Next, Colleen. Background continued. It's located in Sia County. No, you have gone very far. Next. Next. Yes. It is located in Sia County, in Ugenya sub-county. Corey, you are going very fast.
I think there may be a lag in Kenya with when she turns the slide and when you actually see
Okay.
it. But yeah,
So yes, that's where we are calling.
Okay.
So it offers favorable environment for studying several health-related courses. The resources include qualified, competent, and committed faculty members, lecture rooms, a well-equipped skill laboratory, and a computer laboratory, well-equipped library resource center, internal services, and other teaching and learning materials. It's a private institution and has a capacity of 240 students, though enrollment is low due to high school fees compared to public institutions. Members will agree that initially we had the intention of working in Bondo, which is a public health facilities, but there was a lot of bureaucracy. But when we approached Matibabu, they accepted to work with us. So what we want to say that it has a capacity, but the enrollment is low because of school fees compared to the public institutions. I think that's good so far for the background.
So for the University of North Carolina at Greensboro, University of North Carolina is one of 17 public universities and higher education schools within the University of North Carolina system. And UNCG is a standalone university, and it confers a number of different degrees. And it's one of the best. It's in the top 10 of schools of nursing in North Carolina, and #1 in North Carolina for social mobility. The UNCG, the School of Nursing's undergraduate program, leads to a Bachelor in Nursing. The first 2 years are general education, and then the following 2 years are primarily focused on nursing and clinical experiences. Their clinical experiences include med-surg, psychiatric nursing, pediatrics, maternal child health, and community and population health. And the community and population health is where this grant project was housed. Students also have a study abroad option with Dr. Audrey Snyder. So with regard to the students that were involved in the project from the University of North Carolina, we had 7 senior nursing undergraduate students. And so the purpose of this project was for rural nursing settings. So rural in North Carolina and rural in Kenya. And I am at an elementary school and in a county that is considered rural. So where our project took place was at an elementary school within Reedsville, which is right here. University of North Carolina at Greensboro is right here. And Reedsville, where the school is, Moss Street Partnership School, is located right here. So further north, about 26 miles north of Greensboro. And it is primarily a farming community with limited resources for health and other resources. So David, I'll mute myself so you can talk about the students and the setting for your students.
Yeah, so thank you, Colleen. For those who participated were six senior nursing students. Normally, why were they 6? According to the placement, the class had a total of 24, but they cannot be placed at the same time. So they go in rotation. So those whom we were able to partner with was 6 nursing students. Thank you.
So the overall goals of this project was really to just develop an international virtual exchange program between 2 rural and remote communities, which I had alluded to previously. And so one of the things which I'll get to as we get to lessons learned and the achievements, but it was really pretty eye-opening for my students here at UNC Greensboro. We were also wanted to provide nursing students the opportunity to participate in a community assessment and community health intervention project in each country through the virtual exchange in the context of rural and remote communities. The specific purposes and objectives were to enhance the existing nursing community health curriculum with a shared global rural experience and compare. We also wanted to compare and contrast the incidence and prevalence of a health condition in each community, including healthcare provider accessibility and barriers and the like. And we also wanted to be able to adopt and implement a community intervention to address a specific health condition. Collaboration details. David, please chime in or let me know what you would like to add in. Just please unmute yourself whenever, or just speak up when you want to. All of our meetings were held via Zoom with Matibabu students signing on with David, and my students signed on with a with my computer or individual computers. So this picture that you see was our first meeting, and I had all of our nursing students together. This was our orientation day, and so we met with David and sort of developed a plan. The other piece that we did to try to facilitate further communication between the students was that we developed a group text through WhatsApp, which is a phone application. That is one that is a little bit easier to use in different parts of the world. So we didn't have the connectivity issue necessarily as we did with Zoom. So the first meeting was, what you're seeing here was with Matibabu and UNC School of Nursing. And David, do you want to add anything here, please?
I think it's okay. I will add later.
Okay, so one of the initial things that we did was to compare the health systems in Kenya and the health systems in the United States. This is just kind of the other side of that, of the picture that you see. This was our first meeting, and we're in an elementary school here in Reedsville. It's called Moss Street Partnership School. So the other details of this collaboration were that we were to develop a community diagnosis for both teams, and each institution used a different steps. The Matibabu students completed a very detailed, David, very detailed community assessment and diagnosis and they completed their documents, which was then shared with the Kenyan government. Our students, the UNCG students, we used a much broader approach given our time constraints and the time that we had and the overall purpose of the experience. So I'll let David speak to the steps in his community diagnosis for Matibabu.
Yeah, we were able to do community diagnosis And these are the steps that we used. We identified area of community diagnosis and set objectives. We did a sampling, and after sampling, we landed in a sub-location. In Kenya, the smallest unit in administratively is a sub-location. So we landed in a sub-location. Then we had an entry into community where we met the community stakeholders. This is a step in community diagnosis where we say that we have to meet with the community stakeholders so that we explain to them what is to be done. This is important so that we don't get resistance, because leaders in the community. Then we some tools. During the exploration, we map the community. And at this particular time, we get the boundaries, and then to enable us know where we are going to work. Then after that, we do the questionnaire, which we did a detailed one, just as Colleen had said. Then we pre-test. When we are pre-testing, we go to a different area where we are not going to do the survey. Then we collect data, there's data collection. Then we analyze and we do presentation and report. This one we give to the government key leaders. Then later we had a community action day where the community are brought together and the feedback given. So these are the steps in summary, and probably we can have another time to explain in details. I think that one makes sense, Colleen, for now.
David, is it okay if I add a little bit of information about your process? From what I understand. Yeah.
Can you?
Is that okay?
For now, unless somebody has a question.
Okay. So UNC Greensboro's steps in the community assessment for this that the students completed was much broader. Our students were in clinical once a week over the course of the semester, while David's was immersed in the villages or the village for 1 month. And what I will say is that the approach that David used was really more from our standards would be a research project, a very detailed, go into the community, talk to different families. It was very detailed. Ours, because of the scope of ours was different. And so what our students did was that they reviewed completed community assessments for the county and city of Rockingham County and Reidsville City. And our students examined the social determinants of health affecting the community. And then at the school level specifically, interviews with school staff were the interviews that were primarily conducted, and those were done with the school counselor, the school guidance counselor, and the school nurse. And this was for the information about the school and community needs. And next, they compared and contrasted the stated needs among the school staff with what the county and city, their community assessment was, and then compared that also with the observed and the communicated needs among the school student population. And then our students decided on a potential intervention for the student community. Oops.
What I didn't add, Colleen, I think we did share a completed report. After all these things,
Yes.
Colleen, did you get our report?
I don't have it here, but yes, you had shared that with us. Would you
Yes.
like to say
So we
anything?
had a detailed.
Yes, please,
Yeah.
please, would you like to say a few things about your assessment?
Okay. I did not prepare to go into the major details, but what I will say that we shared the report and there are things that we found at the gaps. Actually, what Colleen was saying, that's like was our community diagnosis like a research. And then we analyzed and we identified the community health priorities. Probably, unless a specification comes, we had a report that we shared, and that one can be even put in the GRNN website. Okay, thank you.
Okay, and for our students, what they found was that in the county and city, the primary health needs were opioids, opioid addiction, overdose, and then an access to healthcare. Heart disease was a big one, and then asthma as well. And it was interesting that at the school level, the students that spoke with the school staff, their perspective was that the primary needs were food access and healthcare access. And what the observed needs were with the students was connected. It was connected. So it was what they noticed, what the nursing students noticed was that many of the children were obese, overweight and obese. And so their perspective was that they wanted to implement, which is connected to food, right? Because if for the population that's on government assistance, there's only so much, and the foods that cost more are healthier. So the less expensive foods, of course, are higher fat, higher salt, higher sugar. And our nursing students felt that the primary need would be for the kids to get more exercise, have a structured recess during the school day, drink more water as opposed to sugary beverages, and just even exercising just a little bit more, just walking around the track. There is a path at the school which could be used more in a more structured way, like a walk and learn, if nothing else. So those were kind of the primary concerns at the school and student level. So budget, the overall budget, we of course had $5,000, and Matibabu received $3,480, which this is the comparison here. $1 is 117 Kenya shillings. They received 407,000, almost 408,000 shillings, and we used $1,520. So I'm not sure if you want to go through the details, David, of how your money was spent. There are two slides of that. I know that we did transfer more to you from ours. There was an imbalance just so that y'all could have more bundles, so that you could get more bundles. Was there anything else that you wanted to say about that or the budget itself?
Okay, thank you, Colin. You are low. I could not get all the words, but we got a total of. Can you move up so that we get the total down first? Kindly up. No, just in my slides. The total in my slides.
Okay.
Okay. no, get back.
So you're
Okay, let me read. So I wanted to get the exact. I thought it was not 400, but what hit our account was like I think 355, 177. I don't memorize it, but it is down there. But anyway, this is how we use the money. What the challenge we had, we were not able to ride 100% on the school program. This one, because could we have done it in the region where they were, the community were already, there was a lot of survey which had gone on. So in my own wisdom, I thought that we could use a different community, because normally they have a community where they've been doing community diagnosis. So sometimes when it is done in one community severally, they get fed up. So that is why we went to a different location after the sampling. So how did we use the money? There was data collection. So in data collection, this is, we used 43,000 Kenya shillings. The justification was to collect data and process for community diagnosis. Then we also used, the item was data analysis. So the justification was to get analyzed data, which we used 5,000. Why were we using 5,000? At some point, we had to use the IT, those who are who have a better understanding, who knows how to analyze data. So we facilitated with that money. Then we also, during the community feedback meeting, after the survey, we brought everybody in the community. And during that time, we were tents, public address system, and refreshment. So this one, the justification was feedback to the community members. The purpose of this is to give them feedback on the data that we have used. So that one was coming to 17,000. Then there was bank charges, which was 1,577, which was 350. I think, correct, there are some things that we have omitted. This one does not come to, there are
the other slide
things that, okay, yeah, yes, that's where we are. So first of all, we started with administration cost. This one was banked to the college, that is 75. Then we were also able to buy these equipments, and the justification was to facilitate Zoom meeting. What we were supposed to buy? The laptop, the LCD, UPS, generators, and cameras. In our context, we were signing at a central place, and that is why we were using a laptop and LCD to project. The UPS was supposed to stabilize power when power goes off. Like in Kenya, there is a lot of power can go in and out at any given point. The cameras were supposed to light. So when we were doing as much as we were together, they could be seen. I think, Corey, you can attest that you could see everybody. And the purpose was to facilitate Zoom meeting. And all these things costed 161,000. The bundles to aid connectivity. Here we use a mobile connectivity. Like now, you have to buy bundles. And because it's a mobile subscriber, the charges are very high. That is why we use this much. And then we also use 5,000 for power blackouts when there's power to power generator. Then we had a community entry. We were using, their government officers stay differently, and you have to start from the upper and up to the lower level. We used transport of 5,000. And then in the community's diagnosis process, there is mapping. This is where we do a transect work to enable us understand the community. We use 10,000. When we are doing a community entry, we use the volunteers at the village. We have to facilitate them because we have taken their time, and that is why we used 10,000. Next. Next slide, Corey. Yes, now it continues. You know, it started from there, and I was thinking, where are the rest? Get back, just one step back. Get back, please. Once, yes. And that is why now we have the data collection. Next.
David, you only had 2 slides for your budget.
Next. The next after this, Colleen.
Okay, so I put our budget in here. So this is what UNC Greensboro used for theirs. Was there something else that you needed to add?
Yes, but now I've given the full details, and that's what we used. Otherwise, we want to thank you. Other things I'm going to list in the successes and the challenges later. You can continue, Colleen.
Okay. So for the money that we had from the grant, 350 went to indirect costs for the university. And then the rest we used for an LCD, we're using for an LCD projector and a university approved computer so that we can also, we will be able to use this moving forward in other presentations in the community, in different communities. And we have 26 left, we'll have 26 left over. So moving to achievements. So the UNC Greensboro students, they felt very positive about the cultural experience. They said that they were, the biggest frustration I would say was the connectivity, was the disruption in our ability to stay connected on a Zoom, to get connected, stay connected to on the Zoom through KECHN because of the instability, I think, David, on the ability within Kenya. But the students, they just really felt as though they just have a more global perspective of available resources or lack thereof in other countries, specifically in Kenya, versus in North Carolina here. Now, indeed, and just a deeper understanding of the environment which others live, and that's just going to contribute to their ability to meet people where they're at when they come in, when they're taking care of patients. And so what that looks like is that indeed there are families, homes that everybody, pretty much, not everybody, but pretty much in North Carolina, most households have plumbing. However, they may not be able to pay their water bills, so they may not be able to use their plumbing. Whereas in Kenya, the piped plumbing is much more limited in some areas, at least in the rural areas. And that was quite the eye-opening experience for my students. And that's invaluable. And that's just I think it's a life-changing experience. It was for me anyway. So I just really appreciated this whole opportunity, and I learned. It was a huge learning curve for me, and just learning going through all of this. But anyway, so they also, understanding of needs of the community and village. This was just an opportunity to share experiences. The WhatsApp, we'd hope that the WhatsApp group chat would be more active, but even with prompts, it was just kind of difficult for students to kind of re-engage, partly because the school rotation in Kenya was 1 month, whereas our students were in class over a semester. So the Kenyan students moved on to another clinical or coursework while our students were still in clinicals. David, did you want to add Anything from the other pieces here?
I want to add something on. I wanted to say that the same thing we shared with the UNCG, deep understanding of your system. When we started, we really were able to understand the system in the USA and how the health system is strong compared to the skeleton system that we have here in Kenya. So that one was a bigger a learning time. But we also able to understand the needs of the community where we are doing the diagnosis. We had the opportunity to share. The bigger thing that we had the gadgets, we were here, we were thinking of how we can Zoom, and there were a lot of challenges. And we were able to have the equipment which is going to set a base on what we are going to use even in future. And these are the things that sometimes when the power is off, we use them during our teaching in Matibabu. So that one was great. And we were able to get results of the community diagnosis, and the financial support that was given was able to help us not to do a community diagnosis in communities where it has been done just for the sake of doing it, but we are able to do it in a different community where this one has not been done. And we are able to share the report with the Kenya government and the partners in this country. Surely it was too scientific, as Colleen has attested. I was also able to learn more as a student, and also at the same time as a lecturer. Thank you.
So moving towards the challenges and difference and lessons learned, I sort of alluded to them previously, but the different schedule and timeline for the students created challenges. The Matibabu students are in the village. They live in the village, as I understand, for 1 month, and then they move on to something different, while our students were just driving to clinical one day per week. Sometimes they were at the school, sometimes they were elsewhere. And then that just kind of created challenges for the continuity. And so David's students, they cranked through their project, and we were still excuse me, establishing exactly what we were going to do. And so there was just a disconnect, unfortunately, because of that. It just and I know that moving forward we would do it differently. So then the connectivity, that was an ongoing challenge. And then the scope of the project for each group, like I said, I mean, in the United States, what David's group did, we would have to go get IRB approval, and it was very detailed. It was pretty impressive, and ours was more broader. So it was really interesting. David, did you want to say anything else about this? The challenges?
Yeah, first of all, I want to accept that this one was a new program and we were learning. We had not understood very well how it runs. And here in Kenya, when students get into class, the schedule is tight, which culminates in doing their end nursing council exams. So each and every day matters, and there's no break in between. So when where we will really use them is when they have their rural health and when they are doing their community diagnosis. And it was 1 month, very intensive. While in the UNCG, it was different. So tying those different students and the timing was a challenge. However, I want to thank Colleen, we were able to adjust, and each and every group learned. Inadequate ICT skills, that is real. I'm still struggling. Colleen, you can attest, most of the time we have tried, and she has been teaching to me how to connect, how to do this, and she's really a good teacher. She's more than IT than a lecturer in nursing. Then another one was connectivity. Right now, like now, I have to go very kilometers from home to get connectivity. Sometimes when you get connectivity, the power is down, and that was a challenge. However, the power issue was being counteracted by the generator. But still, you have to have the means, you have to have a car to carry the generator where you need it. Then that one was a challenge. Then the meeting expectation, the Kenyan students and even the lecturers at Matibabu had very high expectation. For example, when partners come here, they pump money. That is the truth. So they were comparing this and GRNE. So how is this one? So there was a lot of expectation from the lecturers. The Matibabu lecturers thought that anytime, and you know, we were doing it very far from the college. So they wanted transport, they wanted a facilitation, which was a challenge. And then the scope of project for each group. So that one was the challenges, but we can still discuss on how to counteract. But however, we achieved, the project aim was achieved. Probably if given time, we can suggest on other ways to improve it. I want to have a short, if you can give me 1-2 minutes to have a short call, then I come back.
Okay.
Is it agreed? As Colleen continue, I can take a one minute. Agreed?
I can.
Is it agreed?
I can go through the next slide.
As I take a break, 1 minute.
Okay. So moving forward, planning, I think we would do, certainly the UNC Greensboro students, we would, I would definitely have them oriented the summer prior to the semester starting so that we could kind of hit the ground running better. And so what I would do is in the prior year, go into the junior level classroom and talk about that this might be a potential option, that this collaboration, a global collaboration might be an option, and then get a tentative list of people that would be, of students that would be interested in it and participating, and then engage them during the summer and orient them to what the project is, cultural differences, and moving, just that I think even also, I would imagine that the Kenyan students, I'm not sure if they had difficulty understanding us, but just kind of orienting to the accent, it was another kind of logistic piece that is just important to kind of be mentally flexible with regard to kind of them slowing down, to the students slowing down to try to explain certain things. And then the budget, it looks like David put in here a budgetary allocation for an IT person, and then fitting in with students' plans. Thank you again. This was a really, I mean, just for me personally, this was just a really incredible learning experience, very eye-opening, and I just really appreciate the opportunity.
Well, thank you both for an incredibly insightful presentation on your collaboration. At this time, we are going to open up for questions. So please feel free to use your chat feature or the Q&A feature in the Zoom panel, and we will do our best to get to as many questions as we're able to. David, I have a question for you. Would you share a little bit more about your community in Kenya, the people, the location, the landscape? Could you give us a little insight onto that?
Okay, the community where we did the community diagnosis? Yes. So finally, I want to say that the health system in Kenya is very weak. And when I narrow down to the community diagnosis, this is a process by which the health workers and the community do assessment, identify community problems, and then chart, put an action together on how to do it. So the community where we did the community diagnosis, it was one sub-location with about 5,000 people. And they have only one health facility, which is a health center. There are only 2 health workers. And the problem in the community, there is poor sanitation. There's no, there's inadequate safe water. Access to safe water is a problem. The latrine coverage is low. The skill delivery is like 42. Only 42% of the mothers have a skill delivery. When they go to the nearby health facility, the 2 health workers are overwhelmed, and most of the time there are no medicines. So they end up, they are being told to go and buy in the kiosk, and sometimes they don't have money. So there are a lot of challenges, but we will be able to share with you a detailed community, how it was done, and the feedback. So probably the challenge which we had, major, which I think we had, is that after doing the community diagnosis, it is important for the partner doing the diagnosis to do something. But in our case, it was like a learning. So that one was a challenge. So the challenge that we may have is that next time it may be difficult to do the same in the same community. Okay, I don't know whether I've answered or if we have another question.
Thank you. Somebody had asked if you have a dream collaboration in the future. So your next opportunity to collaborate either with each other or with individuals from other countries, like what would a dream collaboration be for either of you?
Okay. I think you can flash back the way forward so that I really remember what I noted. Are you able to flash the way forward?
Do you, the screen share? It was just kind of something about like, what do you wish you could collaborate on? If you could create a new opportunity for a collaboration outside of the one you just did, what would you like to do? What would you like to learn other than what you've already accomplished?
What we are able to learn with the students or with the community?
Not necessarily what this one. I'm trying to figure out, like if you were going to do something brand new.
Yes.
What would you like to do brand new? Not what you did with Colleen, a new opportunity. Is there something that you wish you could explore?
Yeah, first of all, I think I won't say that it will be still important to do many surveys, because when you do a survey, you act on a scientific base. When you just collaborate without a scientific base, it may not be right. So what I want to say, one, we need to do a lot of survey together with the community. The goodness with the community diagnosis is different with research. In the community diagnosis, you work along with the community to find their priority problems, and then you have a way of going about it. That is different with the research where it is scientific and then you just do it. So still, I want to believe that the community assessment give us a scientific base on how to implement. What I want to add that probably what the GRN should work on is that they need to partner with the community, even in a very, very small way. They take just a bit of what has been found to motivate the community to collaborate. And I think that I want to suggest in the exchange, in Kenya, we have a lot of shortage of nurses and healthcare workers. What I want to suggest in this program, we could do an exchange visit where the nurses, whether they're students in their part-time, we can collaborate with us so that we learn together. And as they learn, they beef up the shortage of nurses in this country. I want to say that we train a lot of nurses in this country, but they're not absorbed by the government. They're unemployed, and that's where we have the shortage. Not that we have more manpower, but they're not absorbed. So we can, if we get good volunteers who can come support, it will add a lot. But I want to still believe for us to work on a scientific base, then community assessment will be the way to go, because that is going to inform intervention. Research, you do it alone. The community diagnosis, you partner with the community to identify the community problems, and then you together, you put an action.
Thank you. Colleen, we have an individual from a previous grant who asked you to share how, if you could expand on how you felt this was life-changing. They shared a similar sentiment and wanted you to expand on your experience.
This was just, let me see if I can word this concisely. It was eye-opening to study, to learn about Kenyans' healthcare, and in the rural and remote areas that indeed when somebody, a woman is in labor, if she doesn't walk to the clinic, she may be on the backside of a bike getting a ride there. And that was just the different resources is just exceptionally just polarized. And it just kind of created, I think for me, it certainly just created more of a thought of, gosh, why can't it be more balanced in the world? Because my goodness, you know, to not what David was saying earlier about not having medicines, and you know, just the difference in healthcare, how it is approached. Certainly we're more reactive, right? And I can't speak to it in Kenya per se, but we just have more resources. So it was really just kind of a cultural eye-opening experience. In my heart of hearts, I would love to, answering the question that David answered, would be a study abroad type of option, even if it was just for a couple of weeks, because I think it would just completely be yet another life-changing experience for my students, for sure. So I'm heartened by David's efforts, really, because it's a lot to try to do a project like this. And so I'm very grateful to him for his continued endurance and effort, because it was a lot. I don't know if I answered the question.
No, you did.
Can I say something also?
Of course.
Yes, also we need to, planning could be very important. Remember the challenge that we had, sometimes we are ready, the students, they are not ready. Sometimes they are ready. So I think it's important, if we want to collaborate well, we need to plan well ahead of time. And more importantly, because we are a developed country, we can benefit a lot from your research expertise. And that one could really help us do things that are more scientific. So we can collaborate so that we do it together. Like we go through process, we do the literature together, and if we do it together, then it will be more, it will add to us a lot of value. So I want to thank I want to say that it was a life-changing for me. I learned a lot of IT, and Colleen was training me, but what I want also to request this program to build my capacity in IT, because that one will be better than, so at some point we used to hire the IT. So if you build my capacity so that I am not stuck, then we will have it will be more sustainable. but I'm passionate, and we will work together. If there are things that were not done right, you will forgive me because it was a learning lesson. Was learning. I was learning.
Can I make a few? I'd like to kind of summarize some of the things that I've heard you guys say, David, if that's okay, because I think there are lots of really good learnings to take away from your work together. So I'm going to kind of share back to you what some key things that I've learned from you from your experience with Colleen. So one thing that I heard you say is that it's important, I believe, to have enough time on the front end to do proper planning, to think about how you want to move forward together with your project, and really invest the amount of time together that you need to do that. The other thing that I heard you say is that you believe it's very important to not just collaborate for the sake of collaborating, but to do it in a way that there's some sort of action that's taking place, and to do that in a scientific based way with a community assessment, and then working in collaboration with the other partner as they do the same thing in their community, and then you take it that next step. So you actually try to implement something, even if it's something really small, right?
Yeah, sure.
So you can all share that sense of success together while you're also learning from each other. And so what I heard you say is that in order to do that, you really need to be sure that you have the planning on the front end. The other thing that I heard you say has to do with IT. And one of the things that happened with your project that hopefully won't happen in the future is that our IT tools, like our application that's designed for you to connect with each other, it was not live when you started your work. So I think that, and then also in the future, we've learned that, yes, we do need to provide more support to our grantees when it comes to the applications that they're using to work with each other. So in the future, we will have that support available. And as a matter of fact, we're going to do some training on how to use all of these tools before the grants actually take place. So those are some of the key things that I've learned from you all. One thing that we're going to address, the way we'll address the time frame, is we're adding 6 months to the amount of time to complete the work in the future, which should allow you to do some of the things that you discussed. So anyway, that's what I've heard. And if there's anything that I missed there, or that I heard differently than what you wanted, then let me know. But overall, I think this has been a great learning experience, and it will allow for everyone to have better experiences, even better experiences in the future.
Well, thank you. And we're just past the top of the hour, so I do want to be conscious of everybody's time. I want to thank both Colleen and David for their presentation today. And I also want to remind everybody, as Corey mentioned, and we've talked a little bit about the GRNEN online community, you can access that at grnen.org right from our website. Once you're logged in, you can actually visit our member directory and search for Colleen or David if you're not already connected with them. You can connect with either of them directly through the site. You can message them with additional questions that you may have about their presentation, and you can form connections there. If you have any questions about how to do that or need any assistance, you can always reach out to us at info@grnen.org. And again, thank you for taking the time today. This recording should be available no later than Monday. And we look forward to having you all back with us for future events. Thank you so much again, everyone. Thank you, David. Thank you, Colleen. Thank you, Corey. Have a wonderful day, evening, wherever you are. Take care.
Can I ask a question? Can I ask a question, Stacy?
Absolutely. Absolutely.
Yes, sorry, I almost closed it out.
Can we get the other presentation for the projects?
Yes, if you want to look at any of the other presentations, they're on the website under the events page. The recordings are already posted, so I can send you that link.
And then lastly, what is the next steps? Next steps.
I don't know.
Well, the next steps are we'll have the recording of this presentation posted so you can view that and all of the other presentations. The other next step, David, which would be absolutely wonderful, would be that you choose a partner, an international partner for the next academic year, and you start working on your application. How about that for a next step? Does that work?
Oh, I think
Do we lose him? Okay.
we might have.
Yeah, I think he's frozen.
Thank you.
Okay. Thank
Okay.
you.
Take care,
Bye.
everyone.
Bye-bye.